Let's move quickly to diabetes.
Yes.
Diabetes, you can spend hours on diabetes alone, but then I want to bring you quickly to heart disease and finally to AFib.
Yeah.
Too many topics for a short segment, but I think it's important for people to know this. Let's go to a diagram that we made for you in diabetes. About a third of the country is suffering from diabetes. Billions of people, billions of dollars are being spent in fixing diabetes, a systemic disease that can, again, affect your kidneys. We see this as urologists. We call them nephropathy. We have kidney disease, eye problem, blurry. And what we see in the urology office is people coming with frequent urination, thirst, losing weight. They have tingling of their fingers and toes. And especially in young children and teenagers, we see diabetes is becoming a major crisis. How do we defeat this? Really, people talk about ISIS and terrorists and the people that are killing us. These are the actual terrorists within our country. Between heart disease and diabetes, a lot of people are dying from this.
Right. People with diabetes are about 2 to 4 times more likely to die from heart disease than people without diabetes. I'm going to keep this simple in the interest of time. Go to your doctor and get screened for diabetes, whether it's part of a physical exam or just a quick check, but you want to know what your hemoglobin A1C is. The reason is you start in the normal range, and that is up to a hemoglobin A1C of about 5.6. Once you get into the 5.7 to 6.5 range, you're in the pre-diabetes range. That's a wonderful period to, again, become aware, just like we said with high blood pressure, and say, what can I do to reverse this number so that I don't become a diabetic? Diabetic increases your risk of heart attack. It increases your risk of stroke and peripheral vascular disease. Basically, take everything bad about hypertension and then put diabetes on top of it and understand that the risks at least double and in some cases go up even more. It is an epidemic in this country. You spoke about the Mediterranean diet. You couldn't say anything better. If people could modify their diet, and again, I like to keep it simple. So a couple of quick tools that I've said over the years. Minimize carbohydrate. Carbohydrate is the worst thing for diabetics. Breads and pastas. If you're going to eat those things, eat them in the first half of the day when you can burn them up. Don't eat a lot of it at night. People look at them as comfort food. They come home, they eat bread and pasta. Again, I don't want to get on anybody's bad side. Yeah. Those are good foods, but try and keep them in the first half of the day when you're going to burn them up. Over time, eating like this in the evening will increase your constant sugar levels and over time put you at greater risk of diabetes. Diabetes is reversible provided you monitor it, and most importantly, diet, exercise, and exercise.
I think the reason why you're emphasizing exercise goes to that whole insulin resistance, and by doing the exercise, you activate those receptors and you respond better, and the risk of diabetes goes lower. Just for the record, a lot of people may or may not know what hemoglobin A1C is. It's a blood test that you get, and it basically shows you the average of your blood sugar in about 3 months, instead of like basically getting these random spotty sugar levels that can fluctuate and you wouldn't know what to do. So hemoglobin A1C is part of the test that you can ask your doctor and they will do that.
I'll keep it simple. I describe it as almost like a Christmas ornament, okay? That's floating around your body,
right,
and it's getting decorated with sugar. So when you pull it out at the end of 3 months, you can see how much sugar is on it. And that one number tells you your average blood sugar over the last 3 months. It's a wonderful way to get an idea about what your risk is. And again, it would be a problem if you couldn't do anything about it. But there's so much. We've been talking about diet. We've been talking about exercise. I don't know if you realize this, but there are new agents for the treatment of diabetes that right now have been focusing specifically on their ability to reduce cardiovascular disease. There's one class, I don't want to get too much into the details, but I'm sure your viewers have seen advertisements for drugs like Farxiga. This is a medication that not only lowers blood sugar, but lowers blood pressure. We have new injectable agents for diabetes. These are changing the landscape of the treatment of diabetes, largely because not only do they reduce the sugar, but they actually reduce your risk of heart disease. Well, that's how closely linked these two entities are.
I'm a perfect witness of what exactly happened to one of my patients who was almost I want to say 350 pounds, and not only he had high blood pressure and diabetes, you know, of course he had prostate cancer, and in order to be able to operate on him and do this robotic surgery that I do, we had to really reduce his weight, and I was so impressed by the amount of weight he lost in a short period as a result of some of this treatment that you're talking about. So it is real, and I think diabetes is really westernized. It's a modern era of disease. It's because of our diet, it's because of our wealth of money that we have, the cheap food that we get, and when you add the portions, it's a man-made disease.
Correct.
It's really like in our hands, and I think with diet and exercise, I think you can defeat diabetes.
We are seeing diabetes explode around the world with the growth of the middle class and people eating a Western diet. If you go back to the time when people ate at home, family meals, home-cooked meals, the Mediterranean
Love
diet,
that. Absolutely.
absolutely less diabetes. As we see the westernization of the Middle and the Far East, we're now seeing an explosion of diabetes in parts of the world where there never was diabetes.